Call your friends, call your neighbors. This is going to be an hour that many people are going to want to pay attention to because it's about Obamacare, the Affordable Care Act. It's about expanding Medicaid in the state of Missouri. Who's going to pay? How is it going to be paid? How is it going to look going forward? And one of the people in the thick of it is former United States Senator Kit Bond, who joins us live in studio. Kit Bond, it is always a pleasure. Thanks for joining us here in studio.
McGraw, it's great pleasure to be back with you. I always enjoyed talking with you, and once I found the studio, it was it was great. I've been looking all over West County for it, but I got it.
There you go. Good. Okay. Also with us is State Senator Ryan Silvey. Ryan, you're a Republican from the Kansas City area. Thank you for joining us, Ryan Silvey.
Yeah, thanks a lot. I appreciate you having me on as well.
Let's first start with this, Kit Bond. You are advocating and lobbying for the expansion of Medicaid for the state of Missouri.
It is a reform of entitlements, expansion of Medicaid that go together. These do the things that I believe everybody thinks is sensible. And our good friend Ryan Silvey has a plan that doesn't cost the state general revenue any money. It expands Medicaid to get back some of the $2 billion that Obamacare cut out to stop killing the health care services for the poor.
Can you talk a little closer into the microphone?
Sure. Okay.
Yeah.
And also, we believe, talking with the governor's office, that they would be willing to consider the tax reform proposal that Senator Krause and others in the Republican caucus are supporting. So this is a threefold winner. Everybody wants to reform Medicaid and entitlements, and that's included in Ryan's bill, as well as protecting the state from getting any hit on general revenue.
John Deal, Speaker in the House in waiting, sat in that very chair last week and said that those DHS payments that are going away from the federal government that are to support indigent care for hospitals, he said that's not going away by the federal government. They keep threatening it, but they keep saying that it's now they're going to keep those payments in place for now.
For one year. But Obamacare has already cut $2 billion out of Medicare, and that's the health care for the elderly. Those dollars are going to the same places that provide both Medicare and Medicaid assistance. So you see all over the state institutions, organizations providing low-income health care, everything from rural hospitals to Connect Care in St. Louis, Truman Hospital in Kansas City, and community health centers all over the state facing cutbacks. I've seen them in Mexico, Missouri. They've had tremendous cutbacks there, and physicians are leaving and other providers are going elsewhere, and they aren't going to be able to afford to take care of low-income patients.
Kit Bond, you voted against this as United States Senator. You're now you voted against the Affordable Care Act, but now you're one of the few Republicans publicly coming on the show talking about how expanding this is a good idea. What are the cocktail hours like down in Jefferson City when you're talking to your fellow party members?
I have no problem talking about it because I voted against Obamacare. I still think it's the worst thing that's ever been done to our health care system, and it's going to destroy the good health care system we had. It needed reforms, but it doesn't need government to run it. Now, one of the things that Obamacare provided, and nobody knew about it, as Nancy Pelosi said, you had to pass it, see what's in it. And when we passed it and saw how badly it cut assistance for low-income health care providers, we knew we had to do something. And Republican governors in New Jersey and Pennsylvania and Ohio and
Florida,
Indiana
and
Arizona and Iowa are saying, hey, the federal government has taken away vitally needed resources, and they're threatening to take away more. And you never can tell. Unfortunately, the law is whatever President Obama says it is today. Forget about what was passed by the Congress and signed into law, he keeps changing it.
Right.
And no telling how far he's going to change it.
But this money, supposedly the idea was, and Ryan, I'll get to you in a second. I haven't forgotten about you, Ryan.
He's the main man. He's carrying the ball. We're on the sidelines.
Right. And Ryan, I guess chime in on this as well. The idea was it's bad care to treat people in the emergency room. If we get them into some type of expanded Medicaid, that's better health care for these people at a cheaper cost, and it's less expensive for everybody. That's why they did that, right?
Well, I mean, yeah, certainly the purpose of the Affordable Care Act was to make sure that everybody had coverage, and you know, I'm with Senator Bond on this. I think it was a terrible law, and I think that the ramifications of it being law are worse on the state, and they're creating problems that we have to deal with, and that's why I've jumped into the middle of it. Because even though you hate the law, and even though you tried to stop the law, or Senator Bond tried to stop the law, it's there, and the problems are real, and we can't ignore it.
And so if it's going to be the law of the land, we might as well take advantage of best we can of the law.
Well, not just take advantage of the law. I mean, we need to address the problems that the law created. I mean, what you mentioned a minute ago about the funding, the Medicaid dish payments going away, that's only one piece of the overall cuts package that was passed. I mean, just this year in 2014, the Medicare sequestration cuts are about $90 million, and the other ACA Medicare cuts are about $248 million. So even though the Medicaid has been put on pause for the dish cuts, Missouri hospitals, because of Obamacare, are losing $337 million this year. And if we don't seek a way to address that, Senator Bond's absolutely right. You're going to see rural health centers close. You're going to see, hospitals having to pare back their staff if we don't do something.
Ryan, Silvey, what is your plan? How are you going to solve this problem?
Well, the first thing having been chairman of the House Budget Committee, the first thing that's important to me is to make sure that it's affordable and sustainable and something that we can actually do. So what I wanted to do is make sure that we didn't commit the state to another $200 million a year in Medicaid spending, which is what our federal match would have been. So what we did was we created what's called the Budget Protection Fund, which takes certain populations that we're currently paying for on Medicaid, and right now under today's law we get a 60-40 match. So for every 60 cents the federal government puts in, we put in 40. There are several populations that you can shift to the new program, which bring in 100% this year and next year, and then scales down to 90% eventually. So that generates some inherent savings. What I would do is take those savings and set them aside into a fund, and they begin accruing a balance. When we have to start paying the state's portion to the federal government of the match, we would go to that fund where the savings have been accruing and pay it out of there. But one thing that I had concerns with is this is all based on projections, right? I mean, we're guessing that this is how much money we would save and so forth. So I wanted a backstop. And at the end of that, if there isn't enough money in the fund to cover what the state's portion would be, simply we go and reduce the provider rates in the Medicaid system to the hospitals. And my point was, if the hospitals are the ones that stand to benefit financially, I mean, we're going to get about $2 billion in federal funding that makes its way to the hospitals through decreasing uncompensated care. If they're the ones that stand to benefit, they should be the ones that protect the Missouri taxpayer from footing the bill. And so if that means they don't get $2 billion, they instead get $1.8 billion, I think that's a deal that they would still take, and it's certainly a better deal for the Missouri taxpayer.
Sounds like a great idea. Who's against it?
Well, you've got
let's all do it and go home. What's the argument?
Well, you've got some of my colleagues that just think anything touching this issue is bowing to the will of President Obama, and they just don't want to have anything to do with it. I think there are some of my colleagues that think if we just ignore it long enough, maybe it will get repealed, or maybe it will fall apart. But the problem is, in the meantime, and by the way, I hope it does get repealed. I really do. But in the meantime, it has problems that we have to try and address. And so it's kind of a continuing education process. with several of my colleagues explaining exactly what the impacts are and how we can address them.
There is a philosophy out there, Ryan Silvey, that says that if it was called Bush Care, it would pass, not a problem.
Well, that's an interesting thought. What's interesting to me is that we have had this debate in the past on expanding coverage, and in fact, when Governor Blunt was in office, he proposed a program called Insure Missouri, which had the support. It actually got out of the Senate in Missouri, and made it through to the House floor, and that would have covered people up to like 100 or 120%, and this was just within a few years since I've been in the legislature. So it's something that in the past has been supported, but for some reason today it's not.
What Senator Bond mentioned that there might be sounds like there's some type of grand bargain in the works, maybe a tax cut for the one side and Medicaid expansion for the other side. Where are you in terms of what are the odds you're putting on this that something might get done and we might expand Medicaid?
Well, I would certainly be open to talking to Governor Nixon about that, and I know that there have been some conversations that have gone on in that direction. I think if the other part of my plan does entitlement reform with food stamps and TANF and SNAP. If we had an opportunity as Republicans to stave off some of the problems that are created by this federal law, reform the welfare system with things that we've been trying to do for years and could never get done, and have the opportunity to potentially pass the first income tax cut in 100 years, I don't see how we don't try to make that happen.
Are there people in your party who will say, even if we get the first tax cut in 100 years, it's still not worth compromising and expanding Medicaid?
I'm sure there probably are, and that if that were to materialize as a legitimate offer, that's a conversation that we would have to have internally and figure out exactly how many people would still reject the opportunity for a tax cut and entitlement reform just because it is associated with Obamacare.
Give me some odds. What are the odds of this thing passing?
One thing we learned this week is nothing is ever dead in the Missouri Senate. So until we get closer to the end, it's hard to say. I think it's always alive until the last day.
There was a story that came out, I think it was in STLtoday.com, that said somebody was quoted as saying that you can get it through the House, but the Senate you have some issues with.
Well, I think the issue in the Senate is getting it to a vote. I firmly believe that in the conversations I've had with colleagues, if you took my proposal to reform entitlements, to protect the state taxpayer, and to do this and got it to an actual vote, I think there are the votes in the Senate to pass it. The problem is you have a few senators that know that's the case and therefore will never let it come up for a vote.
That's McGraw. Let me interrupt. I think Ryan thinks the votes in there, a majority in the Senate would pass it, and the majority in the House would pass it. But in the Senate, if 3 or 4 people stand up and say we will filibuster it, then unfortunately in Missouri General Assembly, they won't shut down a filibuster as we did in Congress with cloture. Mm-hmm. They call it calling the previous question. And as a result, 3 or 4 people can hold the entire General Assembly hostage and prevent doing the things that most Republicans I've talked to want. They want to protect the budget. They want to reform entitlements. And now, with an opportunity to get income tax reform, it's a hat trick.
Yeah.
And we need people to be advised of it and perhaps start talking to their senators to make sure they will get behind this.
Ryan Silvey, how much more time left down in this session?
We get done in the middle of May, so I think we've got about 4.5 weeks left.
4.5 weeks. I'll let you get back to work. Ryan Silvey, thank you very much for checking in. Happy holidays.
Thank you so much for having me on. Always good to be with you as well, Senator Bond.
Hey, good to talk to you, Ryan. Senator Silvey. Thanks for all your leadership.
We are going to let go of State Senator Ryan Silvey. You, however, are still in the hot seat, Senator Kit Bond.
Oh, boy. Well, you just talked to the guy who's driving the bus, and he knows the details. I should have been the one to make the comments and let you ask him about the details.
We
he knows them.
We got a lot more to get to with Senator Kit Bond here in studio. Hold that thought, Senator Bond. ARCA stands for the Assistant